Welcome to Chatting with Chitness. My name is Dr. Salil Chitness, and I'm double boarded in general pediatrics and pediatric emergency medicine. And I'm here today to provide medical knowledge to all you parents out there. If you have a true concern about your child, please go seek the advice of a medical professional. Let's get chatting. All right, today we're going to talk about fever management, which is very important. I know all your parents are concerned when your child has a fever. Just remember that a fever is the body's response to infection, and it's actually how we get better. But at the same time, when our child has a fever, they don't feel good, so we need to treat the fever. So it's very easy to treat the fever. I'm going to walk you through it because it'll make them feel better, they'll eat better, they'll drink better, everyone's happy. So there's two medications that we use to treat fever. Tylenol, which we all know, and ibuprofen, sometimes called Motrin. And these are the two medications that we use. The key about using these medications is they're all weight-based. And you really need to have the weight of your child, because when you read the boxes, the weight is not right based on the age. So you need to weigh your child, and unfortunately you have to weigh it in kilograms if you're in America. But I'm gonna tell you the doses. So for ibuprofen, which is also Motrin, the weight dose is 10 milligrams per kilogram with a max of 600 milligrams every 6 hours. And Tylenol is 15 milligrams per kilogram with a max of 650 milligrams every 4 to 6 hours. So how do we treat the fever now that you know this? The best way that I've seen and the way that I use is that you staggered the medications. What that means is you give ibuprofen, and then 3 hours later, you give Tylenol. And then 3 hours later, you give ibuprofen. And then 3 hours later, you give Tylenol. So every 3 hours, you alternate, and that is the best way to keep the fever down and keep your child happy and make them better through this illness. Please leave any comments so we can chat about this next time on Chatting with Chitness. Thank you.